Activity Alliance Annual Disability and Activity Survey 2022 to 2023. Now in its fourth year, our Annual Disability and Activity Survey continues to track disabled people's perceptions and experiences of sport and activity. The survey provides Activity Alliance, our members and other organisations with robust insight on many important issues for disabled people in sport and activity. The survey was conducted by IFF Research from October to December 2022. 1,998 disabled and non-disabled adults aged 16 and over took part. 28 disabled people also took part in a series of online workshops to discuss the findings and ideas for future action. Summary of key findings. The report's findings are split into 7 themes. These were developed from conversations with disabled people and feedback from organisations that deliver and promote activity. Number 1, participation and experience. We are not seeing enough positive trends in disabled people's perceptions and experiences of being active. Many measures for experience and perceptions have not improved since 2019 or since last year. Non-disabled people have seen more positive changes. Disabled people are less likely to have enjoyed the last activity they took part in. 66% of disabled people compared to 78% of non-disabled people. To feel they have the opportunity to be as active as they want, 41% of disabled people compared to 70% of non-disabled people. And to agree activity leaders met their needs, 71% of disabled people compared to 83% of non-disabled people. Positively, the trend of respondents agreeing sport and physical activity is for disabled people continued, with 66% of disabled people agreeing this year compared to 56% in 2019. Disabled people continue to want to be more active, 77% compared to 54% of non-disabled people. Number 2, physical health and healthcare professionals. Healthcare professionals have a key role to play in supporting disabled people improve physical health and overcome fears about risk. Disabled people are twice as likely to feel less able to be active because of changes to their physical health during the pandemic. 75% of disabled people compared to 30% of non-disabled people. Improving or maintaining physical health, 64%, is the top motivation to be active for disabled people. GPs, doctors or nurses are disabled people's top preferred source of advice. Number 3, the rising cost of living. Disabled people continue to be hit harder by the rising cost of living and extra costs. 37% of disabled people say the cost of living crisis has affected how active they are, compared to 32%. of non-disabled people. Only 19% of disabled people said cost did not make a difference to how active they are. Memberships and concessions and having more disposable income would have the most impact for disabled and non-disabled people. Disabled people were more likely to say low-cost ways to be active, help with transport or assistance costs, and social and healthcare budgets would have an impact. Number 4, mental health and well-being. For many disabled people, mental well-being is worse than ever. Disabled people were nearly 3 times more likely than non-disabled people to feel lonely, always or often. 23% of disabled people compared to 8% of non-disabled people. 2/3 of disabled people who felt lonely agreed that being active could help them feel less lonely. 65%. Disabled people were more likely to say the rising cost of living has reduced how much they socialise. 60% of disabled people compared to 48% of non-disabled people. 78% of disabled people and 90% of non-disabled people who take part in activities with others prefer to take part with a mix of disabled and non-disabled people, showing support for inclusive activities. Number 5, representation. Disabled people are half as likely to see people like me, both playing and working in sport and activity. Only 1/3 of disabled people agree that they see people like me playing sport and being active. 32% of disabled people compared to 65% of non-disabled people. 1 in 5 agree that they see people like me working in sport and physical activity. 22% of disabled people compared to 44% of non-disabled people. 12% of disabled people wanted the opportunity to become a coach or have a role in delivering physical activity. This increases to 26% of disabled people who were taking part in organised activities and to 31% of young disabled people. Number 6, co-production and influence. Disabled people want more influence on the policies that affect them and the activities they're involved in. 8 in 10 agree that disabled people should have more of a say in policies that affect them. 81% of disabled people compared to 73% of non-disabled people. Only 1 in 10 disabled people have been given the opportunity to influence or design the activities they are involved in. 10% of disabled people compared to 14% of non-disabled people. Almost half of disabled people, 48%, who are taking part in organised activities, and half of young disabled people, 49%, want to be involved in influencing the types of activities they could take part in. Number 7, outdoor spaces and active travel. Disabled people must have greater access to travel to and be active in more places and spaces, especially outdoors. Disabled people are less likely to be active almost everywhere compared to non-disabled people, apart from at home. For outdoor spaces like parks, countryside and woodland, 43% said this was a place they were usually active, compared to 57% of non-disabled people. Disabled people were most likely to say that they prefer being active in outdoor spaces, indoors at leisure centres, or at home without online or digital tools. Improving outdoor spaces like parks and neighbourhoods is a key area where disabled people want to see improvements. To view and download our annual Disability and Activity Survey 2022 to 2023 full research report, please visit our website www.activityalliance.org.uk/annual-survey. Please contact our research team to discuss how to access, interpret and use the data. Email us research@activityalliance.org.uk.